Hello! I come to you today after quite a long absence to bring you a bad medical science video just to catch you up on where I'm at in my active cancer treatment. I think the last video that I did was the beginning of December, but it was a bookish video, so I'm not quite sure the last time that I checked in with you about health stuff. Basically, from the beginning of December, chemotherapy absolutely whooped my ass. Like, I couldn't even walk, never mind think about filming videos, so hence massive silence YouTube wise. From the middle of January I recovered from chemo, and then not quite 2 weeks ago I went and had a single mastectomy and level 2 node clearance. So basically that means I have no boob on this side compared to this side at the moment. And in your armpit area you have 3 levels of lymph nodes, sort of like here-ish and here-ish and here-ish, and I had the first 2 levels removed. Basically, lymph nodes are the gateway for cancer to the rest of your body, so if you have cancer in a certain area, if they get into the lymph nodes, it means they can spread the cells, they can spread to other areas, which is what we don't want. So I've had that many levels removed. The hospital will then test all of those lymph nodes for cancer and then let me know. I have an appointment on Wednesday to see what the crack is, basically. Going forward, if all of the results are fine from the lymph node biopsies, I'll be having radiotherapy, which, because even with a full mastectomy you can't get rid of all of the breast cells because some of them are attached to your skin at the top and your chest cavity at the bottom, they will do radiotherapy to zap any residual bits and bobs, and yeah, kill, that is the plan. I'll have between, I think it's 15 and 22 sessions depending on what the medical team decides, and yeah, after that I've finished active treatment, which is quite exciting. I have to have hormone therapy, which is basically taking something that will suppress all of the estrogen, or as much of the estrogen as possible in my body, because my particular cancer is estrogen positive, meaning it feeds on the estrogen that's in my body. So yeah, I'll just be taking this in tablet form to start with, and then going forward I'm going to speak with my oncologist to see what the best sort of treatments are. There's like injections and possible ovary removal and lots of other options that we can talk about, and I'll let you know when I know. Obviously, having a boob removed is quite a big deal for a young woman. Like, depends how old you are as to whether you think I'm a young woman or not, but I've just turned 30, so I think of myself as a young woman. Obviously my hair is already gone and is still mostly gone. I mean, all of like eyebrows and lashes are makeup, and I mean I have some, if you can see, some regrowth, which is quite exciting, but it's going to take a long time. And then on top of that, obviously there's a boob gone, which it sucks, but it doesn't suck as hard as I thought it would. I did a lot of, standing in the mirror with, well, not my boob out the way like that, because it wasn't big enough, it wasn't droopy enough that I could sling it over my shoulder. But yeah, a lot of trying to come to terms with it. I think it sounds weird to say I was lucky to have any of this, but I was lucky, I think, to have chemotherapy first, because it gives you time to come to terms with what's going to happen physically to your body, whereas I know that a lot of older women, surgery is the first thing that they do, and so it's a really big change to come to terms with and to take in as your first treatment, because it often happens very quickly as well. It's can be within sort of 2 weeks of diagnosis, you're having a boob locked off and you have to deal with that, whereas I have had time to come to terms with it, think about it a lot. I had an evening with some of my friends on WhatsApp and had a sort of living wake for my boob, and I sent them a lot of pictures, so thank you, wonderful G.I. Jane group girls, for putting up with naked me and yeah, helping me come to terms with what was going to happen. It was very therapeutic and cathartic and helpful. So yeah, you can remember my boobs in all their glory forever and ever and ever. Amen. But yeah, I mean, it is a big thing, you know, but I feel like it's been all right. The actual operation itself was nowhere near as horrible or traumatic as I thought it was going to be. I didn't have a lot of pain afterwards. I had a lot more mobility in my arm than I thought I was going to, and the worst part was post-operation drains, which sort of, when you chop off tissue or interfere with lymph nodes, your body gives off a lot of fluid, and they're there to catch all that. And yeah, having those is a pain, and then having them removed is very unpleasant, but I really can't fault any of the NHS staff at Hartlepool Hospital, which is in the northeast of England. It's all been fine, so really I am ready and willing for the next stage. Yeah, so if you've got any questions about anything else, then do ask me down below, or any other sort of social media outlet, but hopefully that's filled you in on what's going on with me at the moment, and I will see you next time. Ta-ta!